The next speaker is Dr. Marcus Ang from Singapore. His talk is the role of AI in myopia.
You can do it both sides.
You're on that side.
Oh.
You're on that side.
Thanks, PC, and Ming for inviting me to the APMS session. So today I'll be focusing introducing a little bit about the potential role of AI specifically for myopia control. And these are my financial disclosures, none of which are relevant. So myopia is close to my heart because I have two young kids. My wife and I are both ophthalmologists, and we are constantly worried about them developing myopia. But the room is full today, so all of you here understand that myopia is a growing problem, not just in East Asia, but outside of Asia as well. In fact, we are seeing the trends across all continents. And myopia is not just a refractive error. When uncorrected, it affects visual function, but also has been shown to affect education, opportunity, as well as impact in terms of economic burden. So the public costs of not correcting myopia is also associated with the permanent visual impairment from complications that arise from high myopia. So actually we're really concerned what myopia control really should be doing is to prevent myopia from progressing such that the risk of high myopia leading to these potentially blinding complications. So at the global health level, or at least from a public health perspective, I think what we really should be doing is using myopia control, everything that's been talked about so far, to prevent children from developing high myopia and thus complications related to myopia. So I wanted to talk a little bit about how AI could help us with that goal. Right? And so we can divide this into three key areas. Number one, can we use AI to detect myopia? Because if we can detect myopia in large countries such as India and in China, we can then identify which individuals need to be treated. But then that's not good enough. We also would like to have an AI that can predict myopia progression, because not all children progress like in the cases that have been shown so far. And then we can then focus our efforts on those individuals or those children who are at risk or high risk. And then last but not least, what do we treat these kids with? And how do we know whether they're going to respond to all the various treatment modalities that have been presented so far? So I just want to show some examples of what's been done. So first, can we use AI to detect myopia? Actually, there's been a lot of studies that's been published using various types of AI, whether it's machine learning or deep learning. And deep learning, of course, is something which is very popular and it's already been used based on fundus imaging, for example. And now multiple groups have published on this to use fundus images to replace refraction. So a non-refractive based way of diagnosing myopia. However, a lot of the speakers have spoke about this. Myopia is challenging when you're using imaging to diagnose myopia, because these are the issues with myopic eyes. Even fundus imaging can be challenging in high myopes. Axial elongation and irregular structures means that the AI needs to get around these systems. We've gone on to use a fundus-based deep learning approach to translate the AI into handheld devices. So I think this is something of interest in large countries such as India, because now with using the AI, we're able to detect myopia with relative good accuracy in screening and diagnosis for referrals in the future. And what's most important is image quality, but the good news is that actually a lot of the AI is now finding that with using saliency and heat maps and explainability, that actually the area of the fundus image does not have to be so big. So I think in the near future we'll see more of this some sort of technologies using AI to detect myopia. Second aspect is, as I said, who is going to progress? Who are the kids or who are the children at risk of developing myopia progression? And so myopia control is to target these kids who are myopia progression. So a lot of studies has been done, great work all around the world. Sorry for the quality. This is a publication that's open access. But I wanted to highlight two different AI technologies. One is data-driven. So basically, if you look at risk factors, myopia diary, trends, you can actually detect which child actually gets worse. The problem with this type of machine learning or data-driven is that you need multiple visits for you to diagnose which child actually progresses. We published this paper a couple of years ago using a single baseline fundus image in order to detect myopia progression over the next 1 to 3 years, and we were able to achieve this with strong phenotyping as well as good AUCs based on fundus image alone. So from a single visit, without refraction, without without knowing the risk factors, we're able to diagnose or at least triage individuals or children who are at risk of myopia progression. And this, again, apologize for the quality, this has now been replicated in multi-centers as well. Of course, this is all promising, but there are a lot of questions that remain. We want to know, is fundus imaging going to be our next frontier for myopia detection or even progression? What do we look at? Do we look at axial length or refraction? And how do we implement this? Do we need technicians? Can we use technology? Federated learning now. So there are a lot of potential, but I mean, this is just an insight into what could help us detect risk of myopia progression. Now, last but not least, once we've identified the children at risk of progression, what are we going to do? So all the speakers have spoken about myopia control, and actually in the last maybe 5 years or so, myopia control interventions have exploded. We now have a variety, and I've color-coded them. So now, you have environmental, we have red light therapy, we have various optical. In fact, I don't have enough space for the number of optical designs. We have rigid lenses, autokeratology, multifocal soft lenses, and of course, pharmacological, which is low-dose atropine. So, in the last 10 years as well, the amount of evidence and clinical trials that are emerging for all these interventions are also developing. So 10 years ago, we had mainly atropine, but look at it, 10 years later, you now have all these therapies with very good evidence that you have myopia control. So this is a good thing. We now have, as clinicians, we now have so many options to help our myopic children prevent progression. Now, the question really is efficacy. Who do we need to treat? Not every child responds in the same way. And what we, as clinicians, what we really like to have ideally is a crystal ball that tells us, oh, this child needs combo therapy, or this child requires atropine, or this child requires red light therapy. That is soon to come, but is not here yet because we need data to do that. So in our center, we published a study on long-term outcomes of atropine. So from randomized trials performed 10 to 20 years ago, they are now adults, and now we are seeing them again, and we want to know how do they have myopia now? Do they have complications related to myopia, even though they were treated with atropine for 2 years, 10 years ago, right? So I won't go through the study details, but I'm talking about the AI that we're developing from it. So now what we've developed, and we haven't published this yet, is an AI that can hopefully tell us which child responds well to low-dose atropine, right? And who develops long-term myopia. Because it doesn't matter whether you have myopia control in 2 years' time. If you rebound and you develop high myopia 10 years' time, you're still highly myopic, right? And so, again, this is deep learning. And what we're trying to do is to differentiate between slow progressors and fast progressors within 2 years and then 10 years. And this is a potential map of if we can develop enough AI together with all the data sets that we're getting from around the world, a child potentially could come in, have the normal myopia assessment, and then we can straight away run an AI and tell, okay, this child, good progressor, good responder, let's use atropine. Or this child, not so good responder, we should use a higher dose of atropine or combination therapy. So you can see how all the previous speakers have various options, but potentially AI could help us determine which option to choose, potentially. When I keep saying potentially, it's because of the challenges of AI. So if you go to any AI symposium, you will see this again and again. Can we deploy this? Who's going to use it? What's the cost related to deploying such things? And of course, ethics around cybersecurity and data sharing. So these are all the challenges of implementing successful AI. But I don't have time to discuss this, but I think there are also a lot of challenges with myopia-related AI development. So do we have enough data sets? Do we have enough good phenotyping? I just came from an AI session, and whether it's glaucoma or retina or cornea, what we need for accurate AI and successful AI is strong and accurate phenotyping, which can be challenging. And of course, myopia is still currently an East Asian prevalent condition, and so a lot of data sets come from around here. So we need more collaborators here in the room to develop data sets for India, for example. But the good news is AI is rapidly advancing. This slide is now completely outdated. We now have much better AI coming up. Unfortunately, I don't have time to go through this slide, but I think last thing I wanted to share is that even if you have a very successful AI or very accurate AI, you need the infrastructure to implement this into your practice. So it's not good enough to have AI. You need to have the infrastructure, technician training, and also the referral pathways for the entire ecosystem to benefit from this AI. And so I'd just like to conclude by saying that AI is very promising in the field of myopia control. Hopefully one day we'll have AIs that can help us early detect, focus on high-risk children, and then personalize myopia management. I'd like to thank my team from SERI and the AI team in Singapore for supporting all this work.